Welcome everyone, and thank you for joining our webinar today, our webinar on how to advertise and attract patients for telehealth. I am Diya Ranjan, your moderator for today's webinar. In the current scenario, it is extremely critical to effectively market your practice to your current as well as potential customers. So in today's webinar, you will learn and explore tools, tips, and best practices to promote telehealth services that you're offering, as well as promote your practice as a whole. In today's webinar, we will also discuss about the reimbursement policies around telehealth. So the good news is that observing the importance of telehealth in the COVID-19 pandemic, payers are proactively working on providing permanent solutions for coverage for virtual visits. So this is indeed a good time to adopt and promote telehealth as a convenient, easy, and secure option for you as well as your patients. So let me introduce you to our panelists. Joining me in today's webinar is a team of panelists from Bizmatics. We have Chris Ferguson, Vice President Sales, along with Monica Walker, Business Development Manager, and Kristen Neck, Vice President, Revenue Cycle Management Services. So welcome to all our panelists. Before we begin, a few important information. We do have a Q&A session at the end, so please type in your questions in the question box on the right-hand side and send it to us. We will answer them in order. The recording and slides of the webinar will be available to all of you in a follow-up email. Prognosis customers can access it from our resource center also. And last but not the least, we would be doing a few polls, so I request all of you to kindly participate. So let us begin. And here is our first poll. Are you currently using telehealth for patient care? So the answer is you can respond yes or no. And I would keep it open for some more time. All right, so we have 73% who say yes and 27% who say no. So handing it over to Chris right now. So Chris, over to you now.
Okay, thank you, Diya. Hello and welcome everybody to our clinic marketing webinar. And this is a session that we have decided to put on is in an effort to not only help you maximize your usage of telehealth and get the most out of it, but number two, if you don't have it, that's okay. We want to help you in the overall general digital marketing. So in an effort to maximize our time together today, I want to jump right in. And so the first of three questions that I have is, number one, well, why are we here today? Number two, how did we get here? Number three, what do we hope to accomplish? And it started by receiving a direct mailer from Teladoc. And so what that really means to you, how does that come back to you all, is that Teladoc wants to treat your patients. And they're going after your patients directly. They're doing it through advertising, and they're doing it through direct mailings. And that caught my attention because as a patient of a medical practice, I might not have seen my doctor for a year or two or three because I'm in generally good health, so I don't have a need to see my doctor as frequently as other people might. But the fact of the matter is that I'm not hearing from my doctor. I don't think about my doctor all that much. But if the doctor's offering a service like this, I would like to know that, because if I don't know my doctor's offering a particular service, I might just explore elsewhere. And especially in today's digital world, it's too easy for me to find alternatives to what I would normally do. And so we're talking about, we're here today to discuss ways to market your medical practice in the digital and social media world. We got here today because we're asking some of our providers, and they were asking for suggestions on how not only to service their patients, but to attract new patients. The benefit to you is that you are local. Teladoc is a national organization, and they're going after the entire population through telehealth. But you offer many more services than just telehealth. You represent that relationship that I, as a patient, can have with my doctor. And let's face it, the patient-doctor relationship is unique because it's very confidential, it's very inclusive, and it's a relied upon relationship. If I don't feel good, I want to talk to my doctor. I don't necessarily want to pick up the phone. They're going after those folks who don't have that relationship. What we're suggesting to you is for you to have both, to have a telemedicine platform, but also to continue to develop that relationship that you have. So within that geographical region, you're talking with all of your patients and you're keeping that trust in place. What we hope to accomplish today is some of the marketing efforts to be successful in the digital age and using social media. And we're going to get into this just a little bit more detail, but if I can just start off by saying, okay, let's talk about social media very quickly. I'm not talking about a medical practice or a medical clinic simply having, quote unquote, a Facebook page. We're asking you to like our Facebook page. We're going to go into something just a little bit more refined, a little bit more detailed, and hopefully a little bit more beneficial to you. The best part about digital marketing and the social media is that it's fast, it's easy, and it's free for you to use. So the question begs, why not take advantage of these services that are available to you? And so the way this came about is I have a doctor practice, and the doctor and I have developed a relationship. And the doctor said, well, Chris, help me out. If you were to come work for my practice today and you took a look around, what would you do to help me market my practice? Well, the first thing, excuse me, I don't think the slides are going. Dia?
Let's hand it over to Monica to.
Okay, because I'm on the same. Okay, I'm continuing to talk, and here we are with. Okay.
Yes.
I just want to make sure that we're touching on everything. Okay,
Right.
so the first thing that my friend Dr. Andy said was, well, what would you do if you came to my practice? I'd say, okay, follow me. These are some of the steps that I would take. So the first one I would say is in Prognosis itself, in the software program that you have and you have access to, Monica's going to show you this, but you have the ability to go into the database and pull out the information about your patients, and you can actually do a mass mailing campaign to your patients. And what kind of things would you want to put in front of your patients? You might want to put a list of services that you're providing. You might want to say, hey, we just started adding telemedicine. There's a lot of people who are still very nervous about this virus. They don't want to leave the house, or if they do, they're very cautious. Another benefit to a patient as well as a doctor is that it's very convenient for patients to have an encounter with their doctor through telehealth. It's private, it's convenient, it's safe. And so I would want to know that, because when I started my portion of this presentation, I said, I haven't been to my doctor for a while. I don't even know if they offer telehealth. Could I call them? Well, of course I could. But if I was sitting at home and I received an email from Dr. Andy and said, hey, starting Monday of next week, we're offering telehealth. No reason for you to fight traffic, to come to my office and look for a parking spot. We could do it right on the phone, right on the web. And this will be the first line in patient care. Obviously, if you have a life-threatening emergency, please go to the local emergency room. Get the help that you need. But if you've got the sniffles, you're not feeling good, it's a follow-up. This is a good way to get information out to your folks. You can also send things like appointment reminders. You could send out, hey, happy birthday to everybody celebrating in the month of September. So there's a lot of things that you can mass email. But now we're talking about how do we step outside of Prognosis and what are some of the different tools that are available for us to use. Well, the first one I would tell you is Google Business. A lot of people, first thing when they think of a question, they go right onto Google and they type in their question. And that's where Google runs strong. And so you, as a business as a medical clinic, you can go on to Google Business and you own your practice. You own your business, and you can put information about the services that you provide, your hours of operation, the names of the doctors. You can put, if you're having any specials, what are your hours of operation? When are your peak hours versus your lower volume hours? So you can see all of this information, and so can I as the patient. So I've got a wealth of information about you. If you notice on here, though, Google's even now started to ask, do you offer online care? That's, once Google starts doing that, we all know that it's the quote unquote the great Google. So they're recognizing online care, telehealth, telemedicine as being a function and a service that a medical practice should offer. So the answer is either yes or no. Either you do or you don't. In this case, the more yeses that you have, the more options that you offer to patients, the more likely you're going to not just retain your clients, your patients, but you're also going to add new. Just like Google Business, Bing offers a similar service. And because Bing is trying to play catch up to Google, I don't know if they'll ever catch up, but Bing wants to be the go-to, the primary. But I don't know if that's going to happen, but they're starting it as well. They've not added that yet, but since Google's adding online treatments, Bing will soon be adding that as well. The next thing we want to talk about is a Facebook page. What I want to make sure that everybody understands is that in today's world, we're not talking about a Facebook page where you'd walk into the clinic and say, hey, like us on Facebook. That doesn't have as much power as you, as the clinic, hosting your own private Facebook community. And what that is that's by quote unquote invitation only, that you open up to your patients and you ask them to join the network. They have to send a request. You have to approve the request. You can send this out to your patients. You can send this out to other doctors that you might work with. And I think that you'll find the community of information is very open. It's very unique in its own way. We warn to stay everything within HIPAA compliance. So if somebody says, hey, doctor, I have a rash on X. No, we don't want to do that. We want to keep, more of the lighter questions about, hey, with the holidays coming up, are you going to have any holiday hours? Or the doctor and the clinic could then promote and push information. Hey, starting on September the 20th, we're going to have a walk-in clinic for flu shots. And if you'd like to know a little bit more about this coming flu season, as predicted by CDC, the doctor is going to be giving a 5-minute Facebook presentation on what to expect, taking the shot, not taking the shot. And so again, you're staying in front of the doctor, the doctor's staying in front of the patient. The best part about this is, as a patient, I feel like I am an important part of Dr. Andy's community, and that's the doctor I'm using for this purpose, is that I feel like I'm in this patient records club, and I can see everything that they're doing. You might want to have an employee spotlight and say, here, Chris Ferguson has just joined our practice, and he helps in the reception area, and he'll greet you at the door. And so there might be a picture of me with a profile. And so what that does is that lends the comfort to a patient who's walking into the practice the next time they have an in-person visit and say, oh, there's that Chris guy. I remember seeing him on Facebook. And so that's the benefit of having that community. So it's not just like us, it's join our network. And then patients can share that kind of information back and forth with one another as well about how much they're getting out of your practice. You might see reviews. You might be able to respond to reviews. The next one would be Yelp. I've noticed in speaking with some of our practices that they don't typically have a Yelp page. And I don't know if it's that they don't see the benefit, they don't really understand how it works, or they just have, that's just one more thing to do. So what we would recommend is, if I came to work for your practice, I would say, let's identify a person in the practice who's going to be your social media guru. This is the person that's going to make all of the posts. This is the person that's going to accept patients' requests to join the network. I'm going to be the one that goes out and makes sure that all of our information is current. Here's the specials coming up this week. If I'm a podiatry practice, I might say, join our network and receive a code to get 10% off of diabetic footwear or something along that line. So you're promoting, you're engaging patients. Another thing that you could do is when a patient comes in and say on Yelp, check into our practice on Yelp. All of this is really designed to show that you have an active page. You have an active forum where patients can rely on you. They can come to you, they can get information, they can share information back. Another one that's coming up lately is called Nextdoor. Nextdoor is an app that's owned by Facebook. It's a whole separate app altogether. But again, that's within a particular geographic community, like in the zip code. And how that works is I might go on and say, hi, my name is Chris, and I'm new to the area, and I need to find a cardiac doctor who works with pediatrics. Can anybody share with me any experience that they might have with a local doctor? And again, this is all just about social media and coming together to bring information and put it into the hands of the people who need it when they need it. The final thing would be is everybody still has some sort of a local community paper that goes out. It's got a little bit of advertising. It's got some information about community activities. A lot of that is going online, and I'm not talking about the big newspapers because a lot of those you would get lost in. But in your local area, you probably have some sort of a community flyer or a little flyer that comes out that has just a little bit of information and express, hey, so here, I'm Dr. Andy, and we're doing telehealth now, and we're going to do a flu shot clinic. All of this is information that promotes you out to the public, out to the population of patients that would need you. I think too many patients and too many doctors are stuck in the old way of, well, I'm on United Healthcare, quote unquote. I'm on United Healthcare's provider list, and hopefully I'll be able to attract patients that way. I'm saying that you can go to the next level and you will really reap the benefits. These are some simple tools that are available to you today that are fast, easy, and free. And we would invite you to take a look at each one of those. If you needed any help, you could always get a local person. You can call in and ask us. We'll give you some guidance on how to do that. But the benefit to you is that community that you service. And with that, I'll hand it over to Monica.
All right.
Thank you all. Thank you all for your attendance. Yes.
Thank you, Chris. Good to talk to any of you who've been on one of my previous webinars. Good to talk to you guys again today. So what I'm going to talk about, as Chris mentioned, are the ways that you can reach out to your patients actually within Prognosis. So our telemedicine visits, the texts and the emails associated with those, appointment reminders, birthday emails, and then how to send a mass email or a mass text to your existing patient population in Prognosis. So I'm first going to go through each topic on slides, show a couple of examples, and then I'll actually go into Prognosis and show you where each of these things are located. So with the telemedicine visits, hopefully everyone's aware, we have recently in the last few months integrated our own proprietary telemedicine product. So if you're still using the Zoom connected telemedicine product, it's still perfectly fine, it works, but we also have our own integrated now. So if you would like to see a demo of that, at the end of the presentation will be contact information. You can contact support, or if you're still in implementation, talk to your implementation manager about seeing how that functions differently. The integrated telemedicine happens within that third panel in the EHR screen, just the same way that the Zoom integrated telemedicine did. However, it no longer requires a Zoom login. So you can go straight into the visit, no Zoom required. Same for the patients. So they no longer have to download an app. They no longer have to download a Zoom. They don't go to zoom.com. They go to a link from the text message or the email that they receive from scheduling the visit. So when you schedule a telemedicine visit, the patient will receive either a text or an email or both, depending on how your clinic is set up and what information the patient has. And that text has a link to that actual meeting. So it has a date and time of the meeting as well as a link. And I'll show you an example of that right after this slide. The text message reminder for visits can be configured in settings and configurations. So if there are some specifics that you would like to include in that text message or email, those can be configured to add some additional information. We only have so much room within the text message, but email certainly can have as much information as you would like. They also, we have the ability to have a text message for rescheduled visits that automatically go out if you move that telemedicine visit. So they'll receive both an email as well as a text message for both of those as well. So this is what the text message, as it's currently configured, looks like for the telemedicine visit, as well as the email for the telemedicine visit. So the patient would just click this link right here, tells them their date and time, and then it takes them to a screen where they put in their first name, last name, and date of birth, and then it takes them through a set of steps. So if you would like to have patient forms or consent form or collect payment from the patient prior to their telemedicine visit, it can be configured to do one or up to all three. And so it takes them through that workflow and then immediately into the meeting once they're finished with that workflow. You can also now have up to 4 people within the telemedicine visits in Prognosis. You can also pop that screen open into a full-size screen. So we've done a ton of enhancements on the telemedicine piece. And again, if you haven't seen the integrated telemedicine, I highly recommend it. I've been showing it in demos. It works really well. And I think from a previous user myself, I think it's going to be a really great asset for all our practices. So my next topic is the appointment reminder texts and emails. So most of you are most likely using the text reminder service. Just a few details about that. And we do have step-by-step instructions for each of these topics. So if you would like to know how to send a mass email or a mass text or set up your appointment reminder texts and emails, there are also step-by-step instructions for those in the Resource Center. And you've probably all noticed that a Resource Center button has been revamped to have a little picture of a guy with an R and a C on there. So I like the new logo. It's easier to find now. So take a look at that. You can always search that Resource Center for all kinds of how-to documents as well. We have videos. We also have copies of all these webinars on there. But it's just a great resource for finding step-by-step instructions on how to do things. You're also welcome to call support, of course, or your implementation manager if you're still in implementation. So text reminders are a scheduled process, meaning that those get sent at a specific interval. So you can have those text messages sent the day before your appointments. In my previous practice, we actually had those sent 2 days ahead of our appointments, and then we would call the patients the day before if they didn't respond to our text reminders, or we would email the patients the day before. So you have some flexibility there, and your emails are sent through the reminder screen. So you can have those text messages go automatically and then have the emails sent as you go through your actual list of reminders to see which patients didn't confirm their text message. Certain types of encounters can be excluded from text reminders. So for instance, if you schedule patients for 2 visits in a day, you might have an office visit, maybe you're doing a flu shot clinic and you don't want to remind them of the flu shot appointments, you can actually exclude text reminders for that particular encounter type. And again, I'll show how to do that. And you can also configure those emails and your text messages for each of those pieces as well. And this is just a copy of the email for an upcoming appointment. Obviously has our date and time. And since this is an in-person appointment, this isn't a telemedicine appointment, doesn't have our little link on there. However, it does have some specific instructions that I added in there on what we need the patients to bring to their visit. So you can go and configure this and add some additional information there if you want, if you have some specific things that you want to include for your visits there. My next topic is birthday emails. So one of our other sales associates mentioned a couple months ago that her son sees a practice with a competing software and he receives birthday emails, and she thought that was attributable to that particular software. And actually we have that capability as well, but I'm sure that a lot of our practices don't have it turned on. I actually didn't in my previous practice, and I wish that I had. But you can configure an email and they automatically go out on the patient's birthday. So obviously it's pretty important that you put the birth date in accurately, but if you're billing insurance, insurance, you kind of have to do that anyways. And so you can configure that in settings and configuration. You do have to turn on a property though. So there is a property that has to be turned on in the patient registration area of the properties. It may be an administrative property, meaning that back end would need to turn that on for you. But if you're interested in doing this, take a look at it. I'm going to show you where those are. Take a look at it, see if you want to configure something. And then if you need that property turned on, you can just contact support and they can handle that for you as well. And this is a copy of a little birthday email that I created. And of course, it would have your practice logo, your practice information on there. This just came from one of our demo databases that we use for sales, our West Bay clinic. So my last topic is sending mass emails and text messages. So we have the ability to go in and create emails and text messages. You can configure those to advertise, as Chris mentioned, new products that you are selling or new services that you are offering. You can also utilize those to talk about your telemedicine visits, to give them a link to your website, to your Facebook page, to your Facebook group. So anything that you would like to send your patients in a bulk manner, you can send emails and text messages. Again, I'll show you where those go to get configured. One thing to note is that the text messages only allow 405 characters, same as the appointment reminder text messages. So you only have so much kind of space to work with, but the emails don't have that restriction. You can't include a subject in the text message, but those text messages will also apply to your monthly text message package. So if you have a package of 1,000 text messages and you send 1,000 text messages to your patients, you're probably going to have an overage that month, which usually isn't too much of an expensive proposition, but you may want to contact accounting and see what your overage price is there if you haven't, ever gone over before. And to be able to configure those, you can copy and paste from a notepad document. You can also copy and paste from a Word document, but you'll want to make sure that you paste that as plain text, and I'll show you exactly how that works. You can also filter by patients, so you can send text messages to patients over a certain age, or maybe all of your female patients or all of your male patients. So you're able to carve out patients with specific diagnoses and things like that and send messages to the patients that would apply, particularly if it's a new service and you want to apply those to a specific age or gender. So and this is my mass email example. So in this particular one, I have a link here to our Facebook page. We're now offering telemedicine visits. Go to our website to schedule. So you can have information sent to your patients. Kind of looks like this. You can even include a link. So now I am going to go into Prognosis and show you guys. So our emails and our text messages, most everything that we're talking about today is under settings and configuration. And so when you come into this screen, it's under this output templates column right here. So you'll see email here, you'll see text reminder there. So to go and check out my email templates, I click the email word. And so it pops up the first one in alphabetical order. And so when you click the binocular, you'll see your list of emails here. So your confirmation email for your telemedicine visits, this one's the cancellation. We also have the appointment confirmation email here. So this is the email for patients that have visits to be confirmed. We also have our long list of many emails, and I suggest everyone get in here and kind of check out all the different types of emails that we have within the system. So this is telemedicine visit rescheduled. And then we also have, let's see, telemedicine rescheduled. And I'm trying to, oh, here's my birthday email. And so we have our birthday email. So you can come in, you can change this email, add a link to your website if you would like, any information that you want to put into that email, that is how you configure those. So once you have made your edit here, you hit save. You'll also notice in this screen, if you've never edited any of our documents in the past, you have all these little pieces of information that have spaces after them or are in brackets, those are all tags within the system. So those are things that are going to pull automatically for you based on what's in the patient's record or what's in the clinic record. So your clinic name, your clinic address, telephone number, your footers and things like that, those are all configured for you by the system. So as long as you're editing this information in the center here that doesn't have any of those tags surrounding them, they're going to be okay. You can also hit this little plus button right here and see all the list of available tags that you could include within this document. So we have lots of different tags. So if you were to include this information into that document there, put the patient's date of birth. So lots of information that you can pull automatically. And I'm sure you see lots of documents that get pulled from different areas and letters out and things like that. And that's kind of how that information works. But again, as long as you edit this central bit of information, the body of the letter, you're not going to remove any of your footers or anything like that. So back to our configuration and to the text message section. So we have our text reminders here. And so again, it pops up the first one. And so once we click that button, we have our text message for reschedule telemedicine appointments here, for schedule appointment here, for scheduled telemedicine appointment here. So when you click into that actual text message, this is all the information that's going to go to the patient. And again, you'll notice those little tags in there that are going to pull your meeting link, which obviously you don't want to remove that, but it's going to have your appointment provider, date, and time. If there's other information that you would like to include, you can. And it tells you here how many characters you've used. So you have 405 characters that you can utilize in your text reminder. So I still have another 95 characters that I could add. Please bring your insurance card, or bring insurance card and copay, or something like that to the end of my text reminder if I wanted to. Oh, this is a telemedicine visit, so I don't know, please be on time. So you can save that information and update that there. So outside of the text reminder default templates, you can also have specific text reminders go to the patients for specific encounter types. So over in our clinics column here, we have our encounter types. So here's our list of all of our available encounter types, and we have lots of different encounter types to demonstrate in our demo databases. So in here, in my telemedicine new patient visit, I'm going to let that default text message for my telemedicine visits go out, because that's the one that I want on my telemedicine visits. I know that one's configured. But maybe for my annual physical exam, I want to tell them not to eat or drink anything after midnight. So this is an in-person visit. This is one where I want to give them a little bit more information. So when I come into my my encounter type, at the bottom here, you see this little section for text reminder for appointments. So I can let that default message for my in-person visits go, which was fine, or I can customize it and give some specific information. And again, you only have 405 characters to work with, and I've used 399 of them here. So I have mastered being able to use every single field that I can, because I feel like we need to communicate as much as we can with the patient. So I've often had times when I worked on this for 10 or 15 minutes to squeeze everything in there that I wanted to squeeze in there. But you can come in and make a specific text reminder. It's only going to go to those patients that are scheduled for this encounter type. So theoretically, each of your encounter types could have a different text message that goes out, and the patients will get this instead of that default text message. Also, if I didn't want patients who were scheduled for an annual physical to get a text message at all, I could just click that exclude button, and then patients that are scheduled for this would no longer get a text message about their visit for that particular encounter type. So multiple choices there that gives you a lot of flexibility to communicate with your patients via text message in the way that makes the most sense for your practice. And then my last little section is the mass emails and texts. So again, under my settings area, but this time under processes instead of configuration, you will see custom messages under the email and text messaging column. So when you click that, it's going to pop up a email box. It looks like you're sending an email to a specific person. However, there's no to line for it. So when you come in here, you can put a subject in there. You can add a message. So I'm sending a message to let my patients know that we're now offering telemedicine visits. Visit our website or call us today to schedule. So when I create this message, the first thing I'm going to do is I'm going to send this to one specific patient. So I've set up a test patient. I just want to make sure this works first. I want to send it to all my 10,000 patients until I've tested it. So this little filter button down here, patient filter, gives me the ability to choose a whole bunch of different things. So this is where you can come in and choose only send it to the self-pay patients, or only send it to males or females, only patients in a certain city, a certain state. However I want to chop them up, I can. But I also can just pick a specific chart number. So I'm going to say equal, and then I know that this is my patient that I have set up as my test patient. So when I say OK, and I hit my send button, now it's going to just tell me that I didn't send it to one patient. I must have typed that in wrong. Normally it says one. So once I have clicked that button to send my patient the message, then I know how many patients have received that message. So if I want to go back in and I want to then send it to all my female patients or all my male patients, then I'm able to send that information to the patients that I would like to. The same function works for text message, except again, it's reminding me that I only have 405 characters. So if I tried to paste my full thing in here, it's going to give me a message when I go to try to send it that I can't send that many text or that many characters. So it will start counting your characters for you to let you know exactly how many you have there. So again, email is here. You have to have a subject for your emails, and then text message, there's no subject, but you are sending the message from this section. And so that is how you send text messages and reminders. So back to our slideshow. Now I will turn it over to Kristen, who is going to be talking about telemedicine billing. But before that, we're going to have another poll from Dia.
Yes. Thank you, Monica. And here is the poll. I'm launching it for everybody. The question is, are you facing issues in getting reimbursements for telehealth? I will keep this poll open, and this will definitely help us in the next discussion. So please put in your answers. A few more seconds. All right, so we do have people do face issues. 18% say yes and 82 say no. So with this, I am handing it over to Kristen for touching on the reimbursement issues for telemedicine. So Kristen, over to you now.
Thank you, Dia. Hello, everyone. Hopefully you're having a great Wednesday. So to start, I did want to let everyone know that a lot of payers are currently talking about how to expand telemedicine beyond COVID. So while COVID kind of started this big uprising in telemedicine, a lot of payers are coming to realize that, their policy that they had in place before COVID needs modification, as this seems to be like a new trend. So on the screen is a few blurbs from a few payers on the changes that they're going to be making next year for telemedicine. Next slide, Monica. Monica?
Can you see my screen?
Yeah, sorry, it was delayed, sorry. Okay, so to start, go back one, sorry. So to start, for telemedicine visits right now, you would bill your normal E&M code as if you saw the patient in person. That's going to be your 99202s to 99215s for audio-visual visits. If the patient can only connect with you via audio, all of the payers have kind of said they want you to bill the phone consult codes, which is the 99441 to 99443. And then in regards to place of service, so when COVID started, payers changed their mind on which place of service they wanted multiple times. There were updates going out almost weekly of, we want place of service 2, now we want 11, we want a modifier, we don't want a modifier. As of this week, this is where some of the top payers are. So a majority of the payers want place of service 11 with modifier 95. That includes Medicare, California Work Comp, Humana, Cigna, United Healthcare, and TRICARE. Aetna and TRICARE for audio-only visits want place of service 02 still with no modifier. So I did provide a blurb on the slides from TRICARE on why they want place of service 02 for the audio only. And then in regards to Medicare, Blue Cross Blue Shield, and other work comps, those are all state specific. So I do recommend you go to that website, or you can even Google Blue Cross Blue Shield of Georgia and Telehealth 2020. And it will pull up their page that you need to be on that will give you details on what place of service to bill. Next slide. This is from Medicare, so it's published on CMS, and it kind of goes over the differences in telehealth visit, virtual check-in versus e-visit. So your telehealth visit is, again, going to be that audio-visual component where you can actually see the patient. An e-visit, you're not actually seeing the patient, so it's only for established patients, and the patient has to initiate the contact with the provider, either via email or the patient portal. And when the provider responds to the patient, they're basically communicating back through the portal to the patient. And those are time-based. And then your virtual check-in codes, those are, again, just for established patients. And it's not, it's slightly misleading because it's not, you can't bill it just for checking in a patient. It's actually when the practitioner speaks with the patient to decide whether or not an office visit is needed. Next slide. For the phone consult code, so this just gives you more details on the time allocation for those. 99441 being up to 10 minutes, 442 goes up to 20, and 443 goes up to 30 minutes. Most payers will deny these codes if you bill them within 7 days of an E&M code. So if you see the patient via telemedicine on Monday and then do a phone consult on Wednesday, the code will deny. Next slide. This is a scenario from United Healthcare. So they actually published a list of different scenarios for providers on their website to try to help billers understand how to bill certain claims for telemedicine. This is the most common scenario right now. So if you have an established patient, regardless if they're being seen for COVID-19. So if they have abdominal pain, you would still follow the same scenario. And that would be to pick the normal E&M that you would use if the patient was in person with the doctor, place of service 11, and modifier 95. Next slide. And this is a sample CMS. Again, with place of service 11, your modifier 95 on the E&M, and then box 32 should list telehealth. Next slide. For reimbursement. So a lot of the payers that had originally said they wanted place of service 2 changed their mind to place of service 11 because they increased payment during COVID-19. So when you bill place of service 02, a majority of time the payers are going to pay you at the facility rate, which is a reduced rate. And they wanted providers to use Place of Service 11 so that they would get that additional reimbursement. We have seen some payers continue to pay at the facility rate, even if you are using Place of Service 11. A majority of the payers are reimbursing the same rates you would get if the patient was seen in office face-to-face. Again, all payers right now have it published on their websites, whether or not they're going to pay you at that higher reimbursement. And then the phone consult codes, reimbursements for those were also increased to accommodate the fact that older patients or certain patients in areas don't have access to video, so they're unable to connect via the audio visual component. Next slide. So this is the average reimbursement being seen across our practices right now for telemedicine. For CPT code 99213, the average that a commercial carrier is paying for that visit is $67.35, and Medicare is averaging $84.13. And then for your phone consult code, the average across all commercial carriers being billed is $30, and Medicare is at $54.56. This does vary depending on what state you're in and the top payers that you bill. So for telehealth ROI, there was a survey done by Teladoc recently to determine how many providers actually track their return on investment when it comes to telehealth. And that found that only 46% of healthcare organizations have tracked that. Of those 46%, more than 50% saw an annual savings of 10% or more on their telehealth platforms, and 29% saw an annual savings of 20% or more. Next slide. So to calculate your ROI in your practice, you would take your gain from investment minus your cost of investment divided by cost of investment. So when you're figuring out your cost of investment for telehealth, things that should play into that is, do you pay for your telemedicine service? Do you pay for Zoom? Do you have a cost of the building where the doctor's sitting? Do you have a staff cost to help the provider with those telemedicine visits, and any equipment costs? Did you purchase new laptops or iPads in the office so that you could do telehealth with the audio visual component? If you see an average of 100 telehealth visits per month that average $75 per visit reimbursed, your gain from investment would be $7,500. And if on average you're paying $79 per provider for your telehealth service, and you purchased an iPad at $530, and you have a staff member who's assisting with those patients that makes $19 an hour and has helped for 50 hours, assuming it's 30 minutes per visit, your cost of investment would be $1,559 per month, and your ROI on that would be 381%. Next slide. So some top challenges that our RCM team has come into with billing telemedicine since COVID-19 started. One, the place of service changing from the payers between March and May. I think it changed. Some payers changed it 3-4 times. So keeping up with those changes and the requirements that they wanted was crucial during the beginning part of telemedicine, but also could have played a role in providers being reimbursed less. On the payer website, some payers, like Cigna, for example, who stated that if you billed with Place of Service 02 initially and got reimbursed at the facility rate, they were going to reprocess those claims automatically and pay at the higher rate. Not every payer has said that. If you do notice that you're getting paid at the facility rate instead of the non-facility rate, we do recommend that you print off the payer's webpage, specifically about COVID and telehealth, and attach it to a low payment appeal. If you use Prognosis, there is a way you can track the reimbursement coming back to make sure that you're getting paid correctly based on articles published by the payers and Medicare saying what they will pay you for those visits. And then another trend is denials for telemedicine. So some of the payers who typically don't pay for telemedicine or didn't prior to COVID have denied the claim, saying that they don't pay for telemedicine. Again, we've attached their actual web pages that say that they are covering it or they're waiving the cost share for the patients in filing those appeals to get it overturned. Now, some payers have said that if they had denials go out like that, they'll automatically reprocess. And moving on to the E&M changes that are going to be happening in 2021. So in 2021, there are going to be big or significant changes to your E&M service codes. Most importantly is that they are deleting CPT code 99201. The second most important item is that time alone may be used to select an E&M code. Factoring into time alone, any non-face-to-face work done the day of the visit can be included in total time. Example would be if the provider reviews x-rays or op reports and medical records prior to the visit, that's all included in the total time. And then the level of history or exams are not a requirement for 2021. And on AMA's website, there is a statement that says the extent of history and physical examination is not an element in selecting office or other outpatient services. Next slide. This is also a publication by AMA that was released recently, detailing elements from medical decision making with the new coding guidelines for E&M codes. So on the slides that you'll get a copy of, I've listed 99211 to 99215 and the differences. Next slide. And then the next one. Coming shortly, we will have a full webinar on these coding changes that are coming up in 2021 to go into more detail about how the E&M codes are going to change and ICD-10 codes as well. And then we do have another webinar coming up from Monica on how to use employer tools effectively. Dia, back to you.
All right. Thank you so much, Chris, Monica, and Kristen, for all the information regarding marketing your practice, regulations around reimbursements, and E&M codes. So let's begin the question and answer session. I do have a few questions. So let me begin with the first one. I think, Kristen, this would be for you. So what is an e-check-in? The question is, what is an e-check-in?
So the e-check-ins are basically the practitioner speaking with the patient over the phone to determine if a telemedicine visit is appropriate versus an in-office visit. So if you're discussing with the patient their rash and how severe it might be, that would be considered an e-check-in. A lot of practices were confused on what an e-check-in was and thought that it was when you just check the patient in for their telemedicine visit, and that is not what it's for.
Okay. The next question is, where can we find step-by-step instructions to send mass email and texts?
Sure. So within Prognosis, let me find my screen here. So our resource center, the little button here has changed, but it's on your top right of your screen, and any screen within Prognosis, even on the billing side. So when you click that, it takes you to the resource center. And there's a search bar right here at the top. So you can also go down and go through the knowledge base videos. Here's where our webinars, including the webinar from today, will eventually go. But if you just want to search, you can come in here and search for your topic. And when you hit search, it will pop up any of the subjects that match or are close to what you put in there. So here's our knowledge base article on how to send mass emails to patients. So you can actually go in there and it gives you step-by-step instructions, just like I did during the video. But if you want to come back and refer to this later, you can always find that information right here.
Thanks, Monica. So this next question is for Kristen. How can I manage the different payers' place of service requirements on my claim?
So if you use Prognosis, you can set up a scrubber check on the billing side for each payer. You would basically go to settings, configuration, there's the scrubber checks, and you can say for Aetna and my telehealth location, place of service must equal and modifier must equal. And then it won't let you send a claim out if it doesn't have the right place of service and modifier combination. It'll actually have a screen that'll pop up telling you what place of service you need to fix. So if you accidentally put place of service 02, the pop-up will say place of service should equal 11. And this is the scrubber check screen. So again, you would say, you could title it Aetna telemedicine requirements. And you can put insurance should equal Aetna, my place of service should equal this, and modifier should equal this.
All right. The next question is more of an open question. Do we still need a Zoom account for the new integrated telemedicine product? And Monica, would you like to take?
I need to unmute myself there. Yes, absolutely. So if you switch to the integrated telemedicine, it's a simple switch that the backend can make from the integrated Zoom piece to the integrated Prognosis telemedicine. You no longer need that Zoom account. So you'll actually handle all of your telemedicine visit within Prognosis when you schedule those appointments. If that encounter type is marked as telemedicine, it automatically sends the patient the invite for the meeting. And then when the patient arrives into the meeting, you're able to just click on the screen within the encounter and start the video right from there, rather than having to have any kind of Zoom login.
All right. This is the last question. Will the E&M webinar go into details on documentation requirements? Kristen?
Yes. So we will have examples, and one of our top certified coders will be speaking to give more detail on documentation requirements as well.
Okay. So thank you once again to all our presenters, and thank you to all our attendees for being here with us for today's webinar. I wanted to say again that you will be receiving the recording of today's webinar in a follow-up email. And as Kristen said, please look out for information on our upcoming webinar. And we have the contact information up there on the slide. If you are a new client, please contact sales@bismaticsinc.com, or an existing client can call our support, tech support. So thank you once again. Thank you for being here. Stay safe and stay healthy. Bye for now.